Assalamualaikum and welcome back to Real Conversations with Anita, a mental health podcast brought to you exclusively by MIASA Malaysia. This is a space where we talk about what matters most, diving deep into real stories, untold experiences, and critical discussions about mental health and well-being. And today's episode, everyone, is a special one. We are exploring on the topic of shifting perceptions in mental health, and I couldn't have asked for a more distinguished line of guests to help unpack this much-needed topic. A deep dive is much needed, of course. Now, first up, we have Dato Dr. Narimah Awin, who is the former Director of Family Health Development at the Ministry of Health Malaysia. She's also the former Technical Advisor for Sexual and Reproductive Health with the United Nations Population Fund and has also served as the WHO Regional Advisor for Maternal and Reproductive Health. Thank you so much, Dato, for being with us today. How are you?
Okay.
Alhamdulillah.
Thank you for inviting me.
Thank you for being with us. And of course, joining us today as well, we have Dr. Hazli Zakaria, the founder and director of Alaminda Healthcare Berhad. He is a psychiatrist who earned his medical degree from the University of Adelaide, Australia, and completed his postgraduate psychiatric training at the University Kebangsaan Malaysia, UKM. And Dr. Hazli has been a strong advocate for mental health, serving as also a former president of the Malaysian Psychiatric Association, and has actively contributed to numerous mental health initiatives, media programs, and also workshops to improve mental health literacy. Now, both of them, everyone, were amongst our distinguished panelists for our International Stigma Conference 2024, which concluded 2 weeks ago, and they shared incredible insights. And today we are excited to learn more from their wealth of experience and perspectives as we dive into this critical conversation of shifting perception. And this has been truly an uphill battle. So welcome to the show, Dr. Narimah and also Dr. Hazli. Now, we truly appreciate, of course, the amazing work that both of you do. I think it's important to look back at maybe the roots of the journey for both of you, because we want to learn about, the people behind the work, right? So we want to begin with you, Dr. Narimah. Dato, you've had obviously a remarkable career, but we also want to look back at how it was for you during your childhood. Maybe what were some memorable experiences, and maybe experiences that has shaped you ataupun build you, Dato, to where you are today. What would you say?
Okay, to start with, if I were to look back at my childhood, first of all, I think I never really thought of becoming a doctor. Come to think of it, when people ask me, did you really have an ambition? I wanted to be a radio announcer.
Oh, mashallah.
Yeah. And even until I went to secondary school, I still wanted to be a radio announcer.
Okay.
And when I started appearing on RTM and Dato Nolida Saidi was the host, I said, Kaida, do you know that because of you, I wanted to be a radio announcer? I really admired Nolida Saidi.
Okay. So you were on the radio show because of...
I was a director.
For interview sessions.
For technical, when there was a cholera outbreak, and doing disease control.
Right.
For maternal and child health, to promote breast cancer screening, those kind of things.
I see.
So, Selamat Pagi Malaysia.
Selamat Pagi Malaysia, yes. Which is still in existence. Yeah.
But I suppose I would consider myself as somebody with a very deep sense of responsibility.
Mashallah.
I'm a very responsible. I mean, now when I look back, I think one of the things that made me, if you can call me successful, I'm not sure whether I am successful.
And you are.
I have a very deep sense of responsibility.
Very
and
important.
I had that what the English call filial piety. I wanted my parents to feel proud.
Right.
And there were 8 siblings, and I knew that none of my siblings would become a doctor. And I knew that for the kampong people to have a doctor in the family was such a big thing.
Yes.
And I know that it would make my father very, very happy. So maybe I should consider being a doctor. And yet, after I went to secondary school in TKC, I still wasn't too sure. And then when it came to streaming, I was in a dilemma. To go to art or to go science. So if I wanted to be a doctor, I have to go to science.
Science, of course.
But I loved English literature and geography so much. I was top of the class. For English literature, nobody could beat me when I was doing, Shakespeare. I would score like 98%, and the next person would score 70%.
Mashallah.
I mean, I really loved English literature.
You're like my daughter. She loves English lit. Yeah.
And then it so happened in TKC, when I was going to lower 6, they started their pure science stream, and the principal said, Narimah, you have to be in that pure science stream because I was the top student and we want to achieve.
Yeah.
So with you in that class, I can imagine we can achieve.
We want to make the school proud.
That sense of responsibility. So that dilemma, I got over that dilemma. Okay, I do pure science. Then I got a Colombo Plan scholarship to do medicine.
I see.
The top students those days were given Colombo Plan scholarship. I got for medicine. Dr. Mazlan Osman, Tasri Mazlan, our astrophysicist, she got it for physics, and another one got it for accounting, I think, accountancy.
Oh, 3 of you.
Yeah, got Colombo Plan scholarship. Then I was offered to do medical study either in Canada or in India. So that was my second dilemma. Which one do I go now? In fact, Anita, if I were writing a book on my life, I think there will be a chapter
just on that,
dealing with dilemmas. It's a long story. We don't have time to talk about it, but I chose India. But it's a very long story how I ended up. And that was the best decision I made in my life. And I went to that part of India that hardly anybody has been to in the northeast, bordering China and Bangladesh. It was a lovely experience. And the MBBS I got was a small thing. What I had was the experience. And learning the culture. So again, there was a point of no return. I'm now doing.
Did you love it the moment when did you start loving it, the doctor part, the medical school? Did you like medical school?
I think that sense of responsibility, I did
was what drive
think that
you.
Liking it was important.
Okay.
Doing it.
Finishing it, a sense of responsibility. I guess I didn't really enjoy that much. I mean, facing the dead body, the dissection, and I was 3 months late. And the way they give you the dead body, one batch will do the upper limb, one batch will do the lower limb, one group will do the human body is divided. And I was late, so I had to do both the upper limb and the lower limb at the same time. So in 3 months I had to do 2 limbs, and it was very tough for me. But it was tough. But I like physiology better than anatomy. Okay.
But anyway, I almost stopped the class. I think I stood second despite being late. So although I did not really enjoy it, I managed to be one of the top students because again that sense of responsibility. So I think that was the one that really drove me. So after getting my degree, I came home. And then the next dilemma after finishing my housemanship, to do clinical medicine or to do public health. Then I joined the medical mission to serve the pilgrims in Mecca. Every morning pergi dekat Kaabah berdoa, Ya Allah, Ya Tuhanku, what do I do? What do I do? And every day, the head of the mission is a public health person, Dato Wan Mahmud.
I see.
And the chief physician is Arwah Dr. Muhammad, you may not know, Dr. Aziz Muhammad. He was a terror, but he was a brilliant, an Australian graduate from Monash, I think. So every day, selepas kita orang tazkirah malam-malam tu, they would preach to me. Wan Mahmud said, Narimah, I think you should do public health. And then Dato Aziz said, Narimah, you come back to JHKL, I'll make you my registrar. You must join my unit. I want you to do medicine. So I was really torn in between.
Okay.
But the obstetrician wanted me to be an obstetrician, Dr. Thomas Ng. So every day I berdoa lah depan Kaabah tu. I think I decided to do public health.
Obviously.
So that's how I
very happy that you pursued public health, doctor.
One of the reason that Narimah have a dilemma because she can do
both.
Anything.
Yes, betul.
Yeah, otherwise, people don't have that problem, Dato.
I don't know.
Because you can do anything that once you decided.
The word can is very vague here. I can do, or rather, I was willing to do. I was, again, that sense of responsibility, whether I can or I cannot. Well, but I guess you're right. I still top the class.
Yeah.
Okay, yeah.
Thank you. Thank you very much.
Also, yeah.
Thank you, Dato, for sharing that. We'll come back to you. Now, Dr. Hazli, for you as well, you've held obviously multiple roles, being former president of the Malaysian Psychiatric Association, and also you've done a lot of mental health awareness in TV, radio, all of that. Now, we would like to bring it back to the early days as well, Dr. Hazli. Maybe a lot of people want to know as well, have you always been mungkin a studious type? Mungkin nerd kalau kita panggil dulu kan. In today's world, people like that. Tapi mungkin dulu-dulu orang outcast sikit kan. But what type of maybe student ataupun teen were you, ataupun student, and what sparked your interest in mental health? Have you always wanted to be a psychiatrist? Maybe a little bit about that first, Dr. Hazli.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam
Thank you,
warahmatullahi.
Anita, for the invitation. It's an honor to be on the same table with
Pad with Dato Narimah.
two strong, wonderful women who can do anything. Look back, right? I never thought myself to be a doctor, as Dato said. And psychiatrist, I don't even know the term when I was young. Come from a very humble background. Dad working in the factory, mom a housewife, the eldest of 3 siblings. Sekolah kampung. Can you imagine that my school, we only have 1 class for each standard. One got 1 class, 2 standard.
Where was this?
In Penang, Seberang Perai, Nibung Tebal, Kampung Jangkat. So it was the first time during the penilaian Darjah 5, Dato'. For the first time, 4 of us got like 5 A's and 4 A's.
Night stage.
2 boys, 2 girls. For the first time.
For the school, you mean?
For the school.
Masya Allah.
And then our cikgu besar waktu tu, Cikgu Nur Hidayah, she decided to sponsor, to pay for us to go for tuition class so that we can go for the aptitude test to enter MRSM.
Faham?
Because there is a test.
Yes.
And she's willing to pay, and she went to pick up us from the house, because you're going to do after school at night. The 2 girls, the parents not really happy to allow, so the 2 boys, and out 2 of us managed to go to MRSM Balik Pulau.
MashaAllah.
The 2 girls, they also managed to go to boarding school, Sekolah Sains.
Okay.
I think without that, I don't think I able to reach who I am. And then without this person by name of Cikgu Nur Hidayah, I don't think 4 of us are able to be who we are right now.
Was she your class teacher?
Cikgu besar.
Oh, guru besar. Oh, the headmistress.
Yes. Then
I hope you kept in touch with her after that.
You should.
Okay, after I finish my medical, and then after psychiatrist finished, and then I already got a family, and then I realized I need to say something. I have to thank this person for doing that to us. I went to look where she lived, and then to brought all my family members to visit her. And then she started to have early dementia symptoms.
I see.
Oh my God.
And then, but of course, she cannot remember me because I'm just one of thousands
Of her students, yes.
But she remember. I asked her, Cikgu ingat tak? Cikgu bayar tuition untuk kita pergi kelas untuk masuk MSM. Sekolah Cangkat. She remember. We took picture, and then I told her, she's one of the superheroes that came to my life to make me realize I can do more that I can do. She's the person who made me believe that I can do more. Walaupun orang biasa, we can do something luar biasa.
InsyaAllah.
She's the first. Along the way, I have a few more
Betul.
people like that. So that is shaped me. One of the you asked me what shaped me to be who I am.
Yes.
Because she's the one who told me that please always give more than what you are expected to, without expecting anything.
Anything in return, yeah.
Wonderful.
So, yes,
Yeah. Go the
she's
extra mile.
My superhero.
Masya
Everyday
Allah.
superhero. I never thought I want to be a psychiatrist, Dato, Anita. And then I thought I want to be an infectious disease or at least respiratory physician. Luckily that I didn't. Otherwise, I will be stressful
During COVID.
Luckily. Because I want to talk about like a focus on TB, something like that.
Faham.
And then I followed my wife who did
Masters,
her postgraduate in restorative dentistry in Newcastle upon Tyne. I did the volunteer work with the age concern. So they are NGO who look after the elderly.
Yeah.
So then they have a program so that they go to the house for people who just lost their spouse in order to provide some kind of support to ensure that they continue to stay independently at their home.
Yes.
And then in order to do that, need to attend the course, like a short course to be a counselor or peri-counselor, they call it. So I entered the course, and then I didn't tell them that I'm a doctor. So and then after the course, they said, "Hey, you are good in what you're doing. You want to further study? They want to offer me certification and then further study to get diploma in counselling."
I see.
So and then I just realized, hey, maybe I have something I do not know,
right?
Which is the ability to listen.
Empathize, maybe.
Yeah, listen to people, to support, and then I start to enjoy when I went to the house of the people who, they are the different culture, but be still able to support them.
Right.
And then I come back. I was in the anesthesia department. Dato Narimah probably still remember Dato Aziz, our psychiatrist, the chief of psychiatrist before.
Of course. Aziz, of course.
Yes. And then I went to the pengarah, deputy director of HKL. I said, I want to go to psychiatry department. They said, no, because there is no vacancy.
I see.
They go to orthopedic or ENT. I said, no, I don't want to do surgical, and I want to explore whether I can do psychiatry. And then master in psychiatrist. And then they said, no need. Psychiatrist, nobody want to go. You will definitely get if you want to. And then, but I went to see Dato Aziz. Dato Aziz, hey, yeah, you're interested, but we don't have it. But I will remember to call you back when we have a vacancy. I went to Putrajaya. I went to Selayang. I just want to do psychiatry after came back from UK. And then, alhamdulillah, someone went to. I still remember Dr. this particular doctor, I forgot his name, but he requested to go back to Kelantan. So I got.
So you got the spot, okay?
And then that is where I start my journey. And then Dato Narimah said that the decision to go to India, one of the best decisions for me. The time that I agree,
pursue psychiatry.
I want to take the challenge to go further in this field, despite my parents said betul ke nak tu nanti hang pun gila macam orang lain juga, and then a lot of other people said no, I think you can better in other specialty, but somehow I want to do this because I told this the answer that I give during the interview for master's program.
Right.
I want to change the way people see psychiatrists and psychiatric field, because now we cannot differentiate which one is psychiatrist, which one is a patient, because both look the same. So that is the reason I want to change how people see psychiatrists, how people see mental health. How can we change the image of psychiatry, the image of people with mental illness? So that is what drives me until
How
today.
appropriate for our topic today.
Exactly,
His
shifting
driving
perceptions.
force was changing the perception.
Betul.
You had such a noble driving
thanks
force.
to Cikgu Nur
Hidayah.
Yeah.
Alhamdulillah.
Wonderful.
Thank you very much, Dr. Hazli, for that. Okay, Dr. Narimah, maybe back to you. So you've dedicated your life to public health in that sense, and you've achieved a lot. Now, can you tell us a little bit about your maybe educational journey and your maybe experiences a little bit in India as well, so that we can all maybe, because you said the experience was what you valued, right? Maybe there was something significant that you got out of that whole experience in India, and also how it has led you to specialize in family health and its critical role in shaping healthier communities, Dato.
Yeah, it's rather a complex situation. So when I was a student there, like I said, I was young, and I went to that part of India, northeast of India. And from Malaysia, for you, an Indian is a Tamilian or a Malayali.
Yep.
They didn't know. I mean, the place where I studied, my classmates have never met a South Indian. They've never met a Tamilian in their life. So I went to Assam, at the Bangladesh border. And I arrived on the 27th of August, 1971. The liberation of Bangladesh was going on. Indira Gandhi was trying to help Mujibur Rahman liberate East Bengal to be Bangladesh, the birth. I saw the painful birth of Bangladesh, and I remembered getting a telegram from our ambassador in Delhi, say, get ready with one bag, with just one, if the situation gets worse, we'll send you an aeroplane, you have to be
brought back,
evacuated from this war zone. And they were building trenches, we were taught how to go into a trench. That's how I started my life, yeah. And it was, I don't know, I didn't even feel scared. So that was one thing, the different people that I met there was, and this is where they are, it's at the foot of the Himalayas, where the hill tribes and the plain tribes are. So I lived with the tribal people, the Mizos, the Lushai, the Kukis. Now you hear this problem in Manipur. They were my friends. Now when I see of the murder in Manipur every night, I say, is my friend still alive?
Right.
And interestingly, they're all born again most of them are born again Christians.
I see.
The evangelist.
Right.
But I couldn't get used to the food there because I liked the food, but people were poor, and my scholarship was very small. Kuala Lumpur gave a very small scholarship. But anyway, I couldn't get used to the poor quality food. I could afford more. There was one Malaysian guy there. He migrated to UK after that. So then he introduced me. He was a devout Catholic. And the nursing school of my medical college is run by the Catholic nuns.
Okay.
It's an Irish order. So he introduced me to Mother Superior and one Sister Blendina. I love Sister Blendina. So they took pity on me. So I ordered food from them. I mean, because to get halal food, there you can get halal food very easily. The Muslim community in Assam is very, very strong, but most I eat vegetarian or fish. So I was very close to the Catholic nuns. I attended the mass. I attended, Then a Muslim family knew that I was a Muslim. The son was my classmate. So he adopted me. Uncle Aziz adopted me.
Mashallah.
So I had my Protestant evangelists who I pray with sometimes Sunday. I attend Sunday school with them. Then I go to church with Sister Blendina. I pray in the church. Then I go and do my namaz. They are Mazhab Hanafi. So for 6 years I lived as a Hanafi. So till today I cannot forget my Hanafi life. Like we don't do Tarawih in the mosque. We have to do at home. And Uncle Aziz, he was a very religious man. So I had a very, very rich experience, these three religions. And then the Sunni and the Shia, they live together, they intermarry. Like here, you look upon so that richness of the experience. Well, to complete the story, I fell in love with an Indian.
Right.
And a Hindu.
Right.
And not from the northeast, he's from the northwest. He's a Gujarati, a total vegetarian, very strict vegetarian. And here I was from Malaysia. Assam is a fish-eating, rice-eating people. So for me, it was very rich. But knowing the tribals, attending all this, so that was something that I can never forget. So the MBBS is just one thing that I got from there. But the richness of living with these
different people,
was really
different culture.
I can never forget that. And by the way, when I came back to Malaysia, my husband followed me. I told the deputy KSU in Kementerian Kesihatan, because they said they were needing doctors. They employed my husband immediately. He was a non-citizen. I said, see, I got a Colombo Plan scholarship to get one MBBS. I came back with 2.
I know. I knew you were heading there,
Buy one, get one free.
one
so
free,
my husband came back with me. So then, after coming...
Tapi how long were you there?
5 years.
5 years. Sampai
That's an interesting story. If you can give me 2 minutes about that. The reason why I chose India and not Canada, 2 reasons. Number one, they said it is 3 reasons rather. It is very, very cold. Toronto.
Canada is very cold.
And I had a sister whose friend had a son studying medicine there. He said, it's too cold. Number 2, it's very far away. My father was a very poor kampung man, humble. There was no way my father could buy an air ticket for me to come home. That's the second. The third reason was Canada, my HSC result, my A-levels result wasn't that fantastic. So I got accepted into Canada, but I would have to do pre-medical. But India saw my result. Wow, this is very good. You don't have to do pre-medical. You jump straight to year 1 straight away. So I saved 1 year. And as soon as I registered there, then the policy of my medical college was year 1 and year 2 for 24 months. They reduce it to 18 months. We forgo our summer holiday and our winter holiday. So I gained 1.5 years. So these were the 3 reasons. And I said that was a wise decision I made. So going back to Mecca, when I was there, so I did tell Dr. Wan Mahmud, I told Dr. Aziz, sorry, I don't think I want to go back to clinical practice. I want to do public health. So Dr. Wan Mahmud said, okay, you go back. Because they were still in Mecca. I came back earlier. Because we come back in batches now. We stay about 3.5 months. So as soon as you go back to Kementerian Kesihatan, you report to me after I came back. So I went back to OPD maybe for a few weeks. So I report to him. He was the head of the Food Quality Control Unit.
Okay.
And the number one officer there was Dr. Harisun, the wife of Dr. Aziz. And I'm related to Aziz by marriage. So Harisun was doing her MPH, said they needed somebody. So I was a very welcome officer.
Right.
So I was doing food quality control. And then the Dato Megan and Tan Sri Khalid Sahan say, oh my, she's an embarrassment. She's there. She's so brilliant. She's got a good career ahead of her. She doesn't even have an MPH. Okay, no interviews. Get her scholarship. Send her to do MPH. So I was one of those macam very spoiled lah. So they gave me a scholarship to go to Manila under Simeo Tropmate.
Okay.
People had to be interviewed to get scholarship, to get a seat. For me, no. It was plain sailing. So in 1982, I went to Manila to do my MPH. Then the dilemma was there. What do you major in? Because they follow the John Hopkins curriculum. You have to major in something. You can do maternal and child health, which is the basis of family health.
Right.
You can do epidemiology or statistics. And I said, I want to do food microbiology because I was working in the food quality control unit.
Betul.
The professor looked at me and said, you want to do food microbiology? Come back to us in 3 days' time. So I wasn't going decided yet. So in 3 days, they called me for an interview. We are very sorry. We have just calculated. You'll be the only student. Nobody else wants to do food microbiology. We have to open a whole new lab for you.
Wow.
It costs too much for the university. You cannot do food microbiology. So then I said, I don't want to do MCH. So I did epidemiology and statistics.
I see.
So remember I said that sense of responsibility I have. This one, I always say I don't like challenges. I don't like to do unusual things.
Okay.
But sometimes I'm against my own principle. So epidemiology and biostatistics in that university in Manila, there were only 2 students because it's too tough.
Yeah.
Everybody was doing maternal and child health or nutrition or public health admin. They love public health admin. So I became the 3rd student. So we were only 3 of us in that class. Me, Malaysian, one Filipino guy, and Myanmarese, who later on became the Minister of Health of Myanmar under Aung San Suu Kyi, because now with the military government, my very good friend. So 3 of us did biostatistics and epidemiology. It was very, very challenging. Again, I topped the class. And it was like the day they released the result, I had to go and renew my Malaysian passport. I came back. They hugged me and they said, we are celebrating on your behalf. I said, why are you celebrating? They said, you topped the class. You got 90%. And the second is that guy, that Filipino who was epidemiology with me. He was a drunkard actually. He had mental problem, but brilliant guy. And he scored 84%.
Right.
And the rest of the class below 60%. I mean, that was how responsible I was in my studies. I think I should be a lifelong student. I always top the class. I have never not topped the class. So
how do you do that?
And I'm not even clever.
No, how do you do that? Is it consistency, Dato? Do you study every day?
I rajin.
Or do you
I study a lot.
You pay full attention in class?
Yes.
Is that what it is?
Spot question.
Okay, you do notes after class.
I do.
You do notes after
and
class.
And Manila, because there were Filipinos, Indonesians and Thais who could not speak English, so weekends I conduct tuition for them.
I see. Okay.
So I taught them. So by teaching, I learn more. Kan?
Dia discipline kan actually. It's a certain discipline.
I was disciplined. I rajin because I knew I'm not intelligent.
Faham?
Because whenever I do an IQ test, I don't score very high.
So you put in the
grew up
extra.
with that burden of knowing I'm not intelligent. So I compensated by working very hard.
Faham?
So I did epidemiology. So I came back to the Ministry of Health. Of course, I worked as an epidemiologist. I enjoyed it. It was just my luck. It was the time when we had so many outbreaks. We had the arsenic poisoning in Kepong, so many food poisonings, and we had the aflatoxin thing in Ipoh. By that time, I was already in Terengganu. I worked as an epidemiologist. But because of the promotional structure in the Ministry of Health. When I was ready to get my super skill G, I had to be transferred somewhere.
Okay.
And my husband was finishing his master's in pathology in University of Malaya. So he was coming out as a pathologist, and Tan Sri Khalid Sahan, the DG, said they will either go to Sabah or to Terengganu. These are the two states that need pathologists very badly. For Narimah, she can go anywhere. So I said, yeah, we're ready to go to Sabah. I had 2 children by then, 2 daughters, ready to go to Sabah. But the last minute, we were called and said, no, you have to go to Terengganu because Sultan Terengganu put in a request, I want a pathologist in my state. I mean, you can't say no to the Sultan, kan? So we spent 4 years in Terengganu. That was very nice. It was a new hospital. I was the senior medical officer of health in Terengganu. There, I had no choice but to like MCH because now I'm in charge of a daerah.
Betul.
You know, and I had like 6 MNHOs under me, 6 clinics, and the main activity was maternal and child health.
So that was how you ventured into maternal and child health. Okay.
But my love was still epidemiology. Whenever there was an outbreak, I would get so excited. I'd even ask my officer to investigate. I would do the investigation myself. So that was how. Then I saw with my own eyes the value of family health.
Okay.
The social cultural determinants of health.
Yes.
The mental health component in the definition of health.
Right.
How there are so many factors affecting the role of religion and culture. I had a staff nurse who did not vaccinate her own children, although she gave vaccines to other children.
Right.
To patients, but not her own children because of the value system, Islamic value systems. So it was my experience, my personal experience, my observation that I began to abandon a little bit this scientific epidemiology. So I was trying to get used to this new platform portfolio in my life. Then after 4 years, I got transferred back to the Kementerian Kesihatan. They sent me back to epidemiology unit because they needed to start the non-communicable disease. All this while I was doing vaccine, I was doing foodborne diseases, but I had to do. Then, of course, coming Manila, I couldn't do food quality anymore. I do food microbiology again. So I had to start the cancer and the NCD, and I started the Healthy Lifestyle Campaign in 1990. It was only after I came back from the Balkans last week that I recall one thing, you know, how the Serbs killed the Bosnians, how I hated the Serb and the Croatians for torturing, for killing the genocide of the Yugoslav war. In 1990, I had a consultant, one of the most gentle, peace-loving, elderly gentleman who was very nervous with me. He was always nervous. Kalau dia dengar azan lagi, dia nervous. He was a Serb from Yugoslavia. He had retired from Geneva. He was a very brilliant doctor. And I got him to help me develop my non-communicable disease program. I still remember him. Then I recall, no wonder, his name was Joseph, no wonder Joseph was so nervous. Then he knew this is a Muslim majority country, very pro-Bosnia. Right. We were supporting Bosnia all the while. Of course he was nervous.
Betul.
I brought him home for dinner to my house. Even then he was very nervous. I just recall that. So I started the non-communicable disease. Then I got a small promotion. They sent me to the training center in IKU. So I did public health training. After 2 years there, they sent me to be the director of IMR, another research institute. I was the first woman, the 25th director of IMR, the first woman to be director. That was when they whispered to me, you are being groomed for the highest post in the ministry.
I see.
It was a secret all this while, Anita, but now this was so many years ago. It's no more a secret. So these 3 gentlemen, the deputy DGs, whispered to me, you behave very well because you'll be the first woman DG. Anyway, to cut a long story short, I did not get to be the first woman DG because of politics. Okay?
Faham.
So that's a very, very, in 1998. So 1998, I was put in cold storage. So that was how I began to. So after IMR, they brought me back to Kementerian. Now I headed the family health development.
Betul.
Then I had no choice. Here I was inheriting a big program, womb to tomb.
Yes.
And when I tell people I'm doing womb to tomb, they say, you're not doing enough. You have to do more. What do I have to do more than that? Do from erection to resurrection. Anyway. So there were some kind of people used to make jokes out of it. Then I inherited. So when Kade was giving me all that praises the other day, well, I deserve it to some extent, but Kade should have mentioned, I did not start it. I inherited it. But my predecessors did not nurture it. So Kade was frustrated. So there was a policy made to decentralize psychiatric treatment. There was a policy to have community mental health. Why was it remaining a policy and nothing was happening until Narimah came? So why did I have to do it? Again, I think my sense of responsibility. And I felt frustrated. And I'm one of those with my epidemiology training. I'm very passionate about translating evidence into policy. If there is evidence that community mental health is important, why must the evidence remain an evidence? It must be translated into something tangible. So because of my passion for that, I wanted to do it, and I had good support from the psychiatrist. Swaran Singh was fantastic. I worked very clear. And then the Prof. Rahman, is it, in UKM? I worked with Prof. Rahman for suicide prevention, and Kade and To. And, you know, I had a very nice psychiatrist, so they really supported me. And it was one of my favorite expansion of program, because I had to expand elderly health, women's health, adolescent health, community mental health, and children with special needs. And much later, I wanted to start a unit called men's health. And I told the meeting, I just want one doctor, one MA, and one nurse, 3 to start men's health. The decision makers were all men, not approved. It took a woman to one men's health unit. They did not approve it. It got approved now. So now I'm helping the Kementerian after so many years. You came for the meeting. Hazli was there at the men's health meeting. So then after IMR, I came back. So that began my whole journey of really, like, again, a point of no return. No. Now I have to do all the expanded program. Then one major thing that happened then was the introduction of family medicine specialists. Again, I am called now the mother of FMS. They laud me, they touch my feet. I said, that's not fair. I did not start it. It was the people before me that started it.
You inherited it, but you made it work.
I was passionate about it, and I fought. And like I fought so much because the clinical specialist said, this FMS, they are half-baked specialists. They will not get the special allowance that we get. I fought for them.
I see.
And one of the things they'll never forget me, Hazli, before I retired in 2007, I wrote a proposal paper to go to JPA. I want JUSA C for my FMS, 5 this year, 10 this year. I made a long chart. And when they got the JUSA-C, they called me. I was already working in Manila. Wow. I cried when I heard that news. Dato, we've got our JUSA-C. I mean, we thank you for it. So, but there were people who started it before me. So now I wanted to start areas of super specialization. So I sent 2 for elderly care in Adelaide. Then Baizuri said she wanted in Kedah, Pendang. She wanted to do mental health. I sent her to England. She went for 6 months in England. After she came back, I visited Pendang. Hazli, I think I've told you this story. I broke down and cried. She said that to a doctor, these patients in all these districts, schizophrenics, they're supposed to go to Alusta Hospital to get their follow-up. They need to go by bus, they need to go by taxi. They can't afford to go there. Since she came there, she treated them at the clinic itself. She treated 28 patients, and 8 schizophrenics were already cured by the time I went to visit her.
Mashallah.
And these 8 were helping in the clinic to counsel the others, because they were people living with experience.
People with lived experience.
So that really made me. But unfortunately, not many FMs wanted to do mental health. After Baizuri, there were not many. Whereas for MCH and for elderly care, it was very, very, very popular.
Thank you.
So that was my journey.
Thank you very much, Dr. Narimah. I think it's a very rich experience that you had. But again, even though you said you inherited it, but I think it was also you that made the whole move, because I remember Dr. Kade said from 12 health clinics, today we have 1,000 plus, kan Dr. Kade? Dr. Hazli, mashallah, alhamdulillah. Thank you very much.
I could have chosen not to do anything.
You could have chosen, yes.
Not to do anything,
and also because of you, people are able to access that help easier because it's in the community kan, and you know, especially our peers kan, bila apa-apa, it's easier to go to a neighborhood clinic, you know, and then you can at least speak to someone and you know, and get certain help or support kan, rather than, you know, we know government hospital queue panjang, you know, nak jumpa psychiatrist susah, even nak buat clinical assessment takes time. So I think thank you very much, Dato Narimah, for everything that you've done. I think leveraging on primary care network works wonders, so thank you for that. Okay, Dr. Hazli, maybe to you, and then we'll take a short break. You know, we have been very fortunate, Dr. Hazli, alhamdulillah, since day one sebenarnya. Dr. Narimah, Dr. Hazli has been, you know, supportive of MIASA, walaupun, you know, 8 years ago, people didn't really know what to make out of us, especially again, like what you said, we are people with lived experience. Tapi masa tu, people didn't really know, okay, what does that mean? You know, how can people with lived experience contribute? Tapi the moment I met Dr. Hazli macam, okay, how can I be of support, and what do we do together? What can we do together? So Dr. Hazli, maybe if you can share with us what inspired you sebenarnya, or what motivated you, or what made you want to support MIASA and our cause, Dr. Hazli, if you can share.
Oh, Anita, when you first came to see me with your assistant,
right,
I hardly know you,
right,
but
don't know me at all.
Yeah, but then I think that's what happened to us, Dato. Narimah, because I just want to share a little bit what Dato Aziz
okay,
did to me. You know that he provide me the place in HKL into department when the Department of Anesthesia said, "Oh, you free to go." So I have 1 month floating nowhere.
Betul, no man's land. Yeah.
He said that please come to Department of Psychiatry, just observe. I have 1 month of just, you know, like kind of rotating and then get the experience. And then in order to apply for the masters, you have to have 3 consecutive years of your appraisal KPI above a certain score.
Okay.
And then when I took unpaid leave to follow my wife, of course I lost that. I have to wait for another 3 years to get the appraisal. So I am not eligible to apply for masters, but I'm old already. I want to do. I'm excited to do. And then they asked me to, Dato Aziz said, just send. Surprisingly, I was called for interview despite do not fulfill the criteria of that. And then when they want to offer the scholarship, they said, no, you are not fulfilled. Then you cannot. Even though you have been, UKM said that, yeah, please come and, you know, you got a place in KM. Because of that, another person, I remember Dr. Pang, both of us not able, do not fulfill the criteria, but we are from HKL. And then we again went to begging for everybody who can do that, including the deputy DG, for us to be accepted. And then there are a few people drop out.
I see.
And then we went to the Chandrasari, the person who will give the offer letter. This person called Dato Aziz directly, and then this person said, Dato, ni ada 2 orang MO in front of me from your ni, should I offer them? Dato Aziz said, please do that. And then we entered 3 months later.
What year was that, Hazli?
2005.
Okay.
Because I don't know why, he probably believed in me. It's the same thing that what
your
happened
teacher
to me. Then that also happened to a few other incidents where people just believe in me, despite they know nothing about me. That's what happened to
us. Yeah.
Because I don't know why. And then I'm maybe not as good in spotting question exam paper. I'm a little bit good in read the character and then have a good impression.
Instinct, maybe?
Yeah.
Instinct.
But having said that, a lot of errors happen also. Because I know, because if we cannot do, why can't we have people who want to do and able to do? And then I was right. Dato, I have difficulties to convince Malaysian Psychiatric Association committee members to support MIASA. The reason, because how do you know that they are going to do what they claim to do. They are new. Why can't we support the NGO or the society that already have established some kind of track record? But said that if we want to support the one who already have track record, how the new one to show that they can do and then have started to have their track record? So we need to have some trust. We need to have some belief and take risks. So because people take risk on us. To think that we able to do, and then why can't we do the same? And then alhamdulillah, and then it's whatever that fighting or whatever the kind of like argument, list all the fact to support, and then luckily that I have Dr. Kade in the community to support whatever that the work want to do with MIASA, and then Prof. Mahani from UKM, that also she was in the committee also. When both of them left, I'm kind
alone.
of like struggling, but luckily at that time I don't have to, because MIASA already show what they are capable of, what they can do, what they have done, and then what they have done speak on
volumes,
and then to defend themselves, and then they don't have to do that in the first place. So coming back, I think...
No, that was a very, very good lesson in being professional.
Yes.
At that point in time, the psychiatrist, whoever made the decision, you have to be objective and professional. Okay, you don't know MIASA. You don't know, are they bad? Are they good? Nobody knows. But why do you have prejudice? Why don't you then test them? I'm sure you did, Hazli. I mean, if Anita turned out to be a disappointment, you would have abandoned her, but she did not. So you must give them an opportunity. That's professionalism.
Yes.
You must evaluate it in a very objective manner.
And then another thing that I also learned, if we not able to support, please don't bring them down.
Yes.
So that
Thank
is
you.
Another thing that I think that is
and
a culture.
This is an area where the need is so big.
Yes,
the more
that's
players
correct.
in the field,
The better.
The better.
Yes.
And at the same time, during my as the president, Dato, Anita, I know that my vision and mission always want to bring the psychiatric fraternity outside.
Yes.
Because I really believe the collaboration with the primary care, with the non-GO, with everybody, with the employer, with anybody but mental health professional only. So that's what we need to do. That is the kind of collaboration and working together, working alliance that we have to do, because mental health is not under the Ministry of Health only.
Oh, yes.
Mental health is everyone's business.
Betul.
So that's what we need to do, and then that's because of that, I trust you, and then I know what you plan to do, and then it sounds reasonable. I know there are a few people came and then sharing with me. I think no, this one. No, the intentions is not clear. The program is not, it's not possible. You do not know, because then that's the whole idea. It's not like just simply accept without really see. No, that people underestimate me sometimes, or just easily. No, because I think with the same intention, the same mission, and then we are clear. At the end of the day, what Dato Narimah is the person that inspired me to be who I am also. Without she realized, she was the one who be the speaker, the talk during our induction.
I see.
And then but she was the one also that that persuade me, I mean, in a way, made me want to stay longer in the KKM also lah.
Faham. During the induction.
She make me as a person inspired to make change, inspired to give back, inspired to, regardless where I'm going to be transferred, I will do. So maybe she was asked to influence us also, persuade us to stay, but it works. And then true enough, during one of the conference, when you do the family medicine conference, she was being celebrated by as if that she's one of the family medicine specialists. Now I know why. Because Anita, to be able to get post and then to get that kind of like promotion for any post in within JPA, right?
Right.
The paperwork is like this.
Faham.
So that's why I think I understand how much the struggle they have, and then how much they feel when they has been approved. And then I think no wonder they are feel so.
Alhamdulillah.
Alhamdulillah.
Because it is also an ibadat, no?
Betul, it is. It
Yeah.
is. Yep.
To serve the community is our ibadat.
It is.
We're doing it in the name of Allah.
Yeah.
Betul.
So I think if every one of us, Dato, Anita, have this kind of intention when do that as a fardu kifayah, and for others, we don't need anything for us as a person. Right?
Yeah, we
So,
understand the bigger cause, kan,
so
sebenarnya.
that's one of the things that we need to shift.
Yes.
Kind of thing that we do, not because some reward just for us. Yes, we will get that. But the most important thing is what we can do to give back to our country.
Society, yeah. I do feel that, me personally, as you guys know, I'm not a doctor, but when I look at doctors, medical professionals, that's always my perception, really, that when you guys embark into this journey, this space, your intention must be for the bigger cause of helping people. I don't think people come in just for the fun of it, going to medical school, Dato Narimah, Dr. Hazli, I know it's not easy. So I'm very, very grateful that you chose where you are today doing this, and of course Dr. Hazli, not only being a psychiatrist, tetapi for giving us a chance, for trusting in us. I think he really helped in paving way for MIASA, especially during the time where Dr. Narimah, people look at us being people with lived experience, yes, tetapi we are perceived being unequal in that sense because we're not medical professional, kita bukan not even a orang kata not even a psychologist, counselor, social worker, we are nothing, we're not certified in that sense, but I think that the work that we have done has spoken for itself. It has spoken volumes sebenarnya. Alhamdulillah, with people like all of you, and of course Dr. Kadir being our advisor since day one. Very, very happy, and Prof. Mahani paved way, Dr. Hazra, of course, and many other silent heroes that have been very supportive, and of course the many, many people out there that have always been supportive of MIASA, making du'as. Very, very thankful and grateful to all of you. Now we are going to take a short break, Dato Narimah and also Dr. Hazli, and when we come back, we are going to dive straight into shifting perceptions when it comes to mental health, and what are our actions moving forward, and what can we do more of, inshallah. So everyone, we are with Dato Dr. Narimah Awin and also Dr. Hazli Zakaria. We will be right back after this short break. Stay with us. How can we begin shifting these perceptions in mental health, starting from home, and how better can we navigate maybe these challenges, Dato? Shifting perceptions of mental health starting from home. How do we shift these perceptions? Because at MIASA, contoh lah Dato kan, when a peer comes to us, right, a person with lived experience, and typically if they're younger, they will come from a home biasanya di mana parents will be a bit dismissive, parents are not knowledgeable about mental health, so that's why sometimes the help and intervention comes in a little bit late. The fact that they come to MIASA pun is already a good thing. So how can we shift that within families? Because if we can catch it early, kan, Dato Narimah, then we can prevent it from escalating further, kan?
Okay.
So maybe some thoughts on this.
Okay, so this is of course really the core of the business, is to change the perception.
Betul.
And of course perception depends on both the knowledge, the attitude, the culture, and it starts before the family. It starts with the individual, whether you are as an individual or you as a parent or you as a sibling. And of course you belong to the bigger unit as a family. And then the family, the community, then all these units have to change that perception, and finally the policymakers. Sometimes the policymakers can be the constraint, the barrier to the shifting of policies. I think the role of NGOs, now I'm going back to the role of CSOs like MIASA,
right.
I must congratulate you because you've done so much in destigmatization and shifting this policy. Because I think the Kementerian was doing it, but somehow it doesn't come out so clearly.
Betul.
Like, we have you're a member of the Health Promotion Council, kan? By having the Health Promotion Council, that is a manifestation of changing people's perception. But it doesn't come out as a clear policy. It's
Betul.
like implicit.
Yes.
Whereas what you are doing, you mention it clearly. We want to destigmatize. We want to change perception. And I think so you must really continue doing this. And
Inshallah.
to me, when I was director of family health and I was trying to do this community mental health, I did not really look at stigmatization in a very serious manner.
I see.
It took me some time to see that, my God, stigma is really very important.
It is.
So maybe because there were competing priorities, trying to get resources, trying to, so many things. And when I went to WHO as regional advisor, I worked hand in hand with people who are in mental health. So while I was doing maternal reproductive health,
Right.
and we were talking about integration, and my colleague in mental health would say that, can we integrate? I said, that's great. So by integrating mental health into other programs,
Right.
you already change the perception
Betul.
of program managers.
Yes.
So now the perception of policymakers and health providers kept changing, that we must integrate the services, and in doing so, we must change the negative perception or the negative ideas that people have on mental health. And when I became the chairman of LPPKN, then I noticed that mental health is something that LPPKN does not look at, rightly so, because it's not something that's not their core business.
Right.
So I started thinking about this. Why don't I use, because family is the unit. I mean, pembangunan keluarga.
Yeah.
So I started talking with my board members that when we do Hari Keluarga, we just not talk about all this, like breast cancer or cervical cancer or sex education. What about mental health? And I had a lot of support at that time when Datin Sri Wan Azizah and Hannah Yu were helming the ministry. And I told them I really want to put mental health as part of this big story on keutuhan keluarga, kan? So to repeat what I said, you must start with the individual, the family, the community, and the policymakers. But Anita, that's the why and the what.
Yeah.
The how is not so easy. How do you do it?
Yeah.
How do you do it? I think what MIASA has been doing is good. One of the things you do is you use all the media that you can. Now social media is so strong. You held the conference. I hope you can repeat a conference like that.
Inshallah.
So we can have more public forums.
Yes.
I think I'm more than happy to come and participate in all your public forums. So the role of media is very important. The role of policymakers are very important.
Right.
And let's optimize instruments that are already there. For example, we are now pursuing the SDGs.
Right.
In the 17 SDGs, mental health is embedded somewhere.
Right.
So it doesn't come out there. So people who are doing SDG 3, looking at the life cost perspective, looking at non-communicable disease, must take out that mental health and pay more attention to it. The health white paper, that was a very good platform.
Yes.
Again, mental health did not come out very strongly. So maybe the psychiatrist did not do enough to
Convince.
menjadikan dia lebih terselah lah, kan, to
Betul.
bring it up to the surface. Let people pay attention to it.
Yeah, I think
So a lot needs to be done.
Yeah, thank you very much, Dato Narimah. I think one of the other things, like you mentioned, having all these different parts of it, but having people with lived experience within all of it, I think that's what is very important. So having our voices represented clearly within all these different segments, because even when we talk about policies, people with lived experience are not really involved in all these kinds of discussions. And like what you said, having public forums, tapi public discourses are also very important. But again, having people with lived experience within the public discourses itself.
Anita, I have a confession to make. Before I came to your conference last month, 2 weeks ago, I did not really think about the value of people with lived experience. I mean,
Mashallah.
this is the first time I saw that, because it takes a lot of courage
It does.
and commitment for
Yes.
the person with the lived experience and
not
mental
easy.
health already with the stigma.
Yes.
We had that problem with HIV/AIDS.
Betul.
The HIV people have long experience.
A lot of
but,
fear, kan?
But what you did 2 weeks ago, to have people, well-known personalities, some of them, that was a huge success. Then I knew the value of people with lived experience.
Yes, very
Nothing
important.
beats that.
Of course,
that is the most valuable.
Betul. Because we live with it every single day, kan, Dato' Narimah. These insights are very important because it provides people hope. It provides people a way out, sebenarnya. So thank you very much, Dr. Narimah. Maybe Dr. Hazli, to you. Now, a lot of people still view mental health as not being a personal issue, kan, because it's not about me, it will never be me, it's not my family, that kind of thing. And what we see today, kan, Dr. Hazli, is always, when even Dato' Narimah, when you said that we've done a lot and all that, tapi we still feel that it's very limited to the mental health space. And so what we have done is we've done a lot of partnerships and collaborations so that we're able to have this awareness and these interventions outside of the mental health space, only through these meaningful and inclusive partnerships. And that's why we work a lot with media, we work a lot with other persons with disability groups, other NCD groups dan sebagainya, so that we're able to touch the masses, kan, Dr. Hazli. Now, how can we shift this perception, Dr. Hazli, so that people understand that this is a shared responsibility? To make it successful, we need everyone to work together, kan? So like how mental health now, at least in Malaysia, hopefully transitioning, and we know that mental health is part of public health rather than it being treated as a specialized illness, and gatekeepers are psychiatrists in that sense, kan? So Dr. Hazli, how do we shift this mindset?
Yes, first we need to realize that mental health issues is everyone issues, everyone business. So the players, not just service providers, everyone. Now, once the gatekeeper is service provider, especially doctors and psychiatrists, the focus will be only for treatment.
Yes.
When the what's wrong with the person, the symptoms, the impairment, rather than we focus also on the prevention and what happened to them after they recovered from their condition. Because some of us, majority of us, still think that once you're diagnosed with certain condition, that you're going to have that, yes, because it's part of the NCD, non-communicable disease, but you no longer have the symptoms with all the treatment that you have. But the treatment need to be maintained, then having a proper meaningful activities, having job, having supported by the family members who understand, and then the colleague, the worker, the co-workers who understand your struggle, but also accept what you have, and then utilize that for the benefit for everyone. So if we shift for not just focusing on the treatment, on the acute, but look at a whole, the early intervention, the prevention, and the recovery, so everyone know the role that they can play. So that's the reason for me, if a mental health is supposed to be under maybe the Prime Ministry rather than under Ministry of Health per se, we need to increase our understanding about mental health. Conversation, the education need to be continued. Until now, recently, yesterday, one of the patient, cikgu, and then the principal asked, because look, you look so now okay, and then she said that she's still taking medication, and then said, why you have to take the medication? People never ask the same scenario if someone has hypertension, high blood pressure, or diabetes, if they're still taking medication. And then the same thing happened to psychiatrists. Or when they come to psychiatrists, it's always will be prescribed medication. Yes, because you came late. You came early. You don't have to. You probably need to go to see
change lifestyle.
Exactly. So that's very important for us to do. And then we need to see also the impact of social determinants of the illness, as Dato mentioned just now. Not focus on the individual, because we have to look into the financial situation, and then how the housing, everything. So that is equally important. For example, once the patient being treated, then they went back to work, and then if the environment still the same, still have this toxic and micromanaged superior, how this person is going to maintain their mental health, for example. So the whole ecosystem need to see, and then we need to look all these experience or seen symptoms, whatever this person has, not as a weakness, not as a problem, so that the person don't feel guilty for having that.
Yeah.
You know, and then the person or the family or the environment do not feel that is kind of burden rather than opportunity. How can we improve? What are the hikmah out of this? We never consider from that. And the last, I think that we need to shift the perception that this is not that person's problem, not the family, not just the employer in that particular organization, but the whole community.
Right.
Take the whole village to raise a boy or a girl. So the same thing also to help them recover from the condition. Work together, collaboration. That's what we are lacking. Coordination. That's what we are lacking. So for me, we have to work together. Honestly, truly, genuinely want to work together, just not pretending working
to
together.
work together. Thank you very much, Dr. Hazli, for that. Okay, we want to maybe embark a little bit on the conversation of stigma. As you know, Dr. Narimah, you mentioned earlier, you didn't really give stigma a very big focus on, but we want to talk a little bit about stigma because stigma is, until today, one of the biggest barriers when it comes to mental health recovery for people who go through these challenges. But we need to take a short break, so we will come back with Dato Dr. Narimah Awin and also Dr. Hazli Zakaria after this. Stay tuned, everyone. We want to touch a little bit about people with lived experience. So Dr. Narimah kan tadi mentioned that before the conference you didn't really see the value sebenarnya of people with lived experience walaupun benda ni dah mentioned or done many years ago. Now, the Lancet Commission actually came out with the Lancet Commission report in 2022 on ending stigma and discrimination, where it has found that people with lived experience must lead or co-lead, as an example, anti-stigma campaigns ataupun be part of amendments in policies, etc., for all these things to become effective. Because you must have, a person who lives with it, who knows how it feels, understands the depth of the challenges and struggles to be able to provide these insights for effective change in that sense. And then what has happened is this year the Mosaic Toolkit came out on ending stigma and discrimination, reinforcing how this is absolutely true. So having persons with lived experience at the very top, leading or co-leading these different initiatives, campaigns, all these different things. Alhamdulillah. Now, with this understanding, Dr. Narimah, also Dr. Hazli, same question to the both of you. How do you think that we can ensure that voices of people with lived experience are effectively amplified? What can we do to make it happen? Because not everyone comes in to the space. As an example, Dr. Hazli, because you know me very well, does not come with my personality ataupun does not come with that certain being vocal, because you need to be very visible in order for you to make change, kan? Especially if you are a person with lived experience and you are not a doctor ataupun you're not a psychologist, not even a counselor in that sense, kan, Dr. Hazli? So you're coming in basically bringing your experience to the table. So how can we amplify the voices of people with lived experience if the only thing you have is just the lived experience? Dr. Hazli, Dr. Narimah, what is your take on this?
I think the logical way of amplification and expanding this, more and more opportunities for them.
Okay.
Create more opportunities for them, either in terms of having more events or have each event to besar-besaran. That means getting more and more people coming for your conference, getting more and more people living with experience. And in the rare event of them having shared the experience and they get something negative, for example, you must have a plan of action. How do you protect them? Maybe they need extra counseling for that. So you must have a plan to protect them from any negative responses simply because they're sharing their experience. So getting more and more people to share, that means more people with lived experience. And
to come out, yeah?
And having a wide wide variety of conditions. People with depression, people with parasuicide, people with drug addiction, people with postpartum depression,
psychosis and all that.
Teenagers with eating disorders. Anorexia is becoming very common nowadays. So get a very broad variety. Of course, I like your conference that day because the people with the lived experience that you brought them from all levels of society. So they need not be influencers or they should not be professional. Anybody who can relate, who can tell their story in a very effective, very honest way.
Genuine way.
I think the simple answer is just more and more opportunities and getting some protection for them in case
negative feedbacks. Thank you very much. I think that's a very important point, Dr. Hazli. Now, when Dato Narimah spoke about more opportunities within maybe events, programs, the conference like what we did, but that's one. Tapi how do we bring the people into such conferences? As an example, even for our International Stigma Conference, we didn't get a lot of participation from psychiatric fraternity as an example. So what can we do, Dr. Hazli?
I think we need to go back to basic.
Okay.
Basic as a human being, actually. Bring back humanity to mental health.
Okay.
Without we realize, we still... The person who service provider, they still consider themselves an expert because they have the training. And then how can we also value the expertise by the people who have the experience? So that's where the working together is all about. How to give the credibility to the people who have his life experience, and how to make the service provider humble enough to be able to learn. So we know that we can be better, be a better person, be a better clinician by understanding from the people who know a lot with what they struggle with. And we also need to use the success story as well, because I don't want to make people think mental illness as a sad thing, that's begging, or all this sad stories, because no, there are many people who are
very successful,
and then how to make them be able to be the source of inspiration. So, and then the whole idea, the working together, understand what everyone's value in that can bring on the table. I really like when Dato Narimah mentioned about how to support for people who are affected by it, because be realistic, not idealistic, because not everybody who come, they are already fully recovered their need. And then that, it means what? It means that we need to plan A to Z for everything that we do, including the challenges, the side effect. Every things have a side effect, not just medication. Psychotherapy have side effect. Even attending conferences also can have a side effect. If we are not overwhelmed with that. That's how to do that, because I think you guys are very well aware. So that's the reason that remind that for those who are triggered by all the discussion, they have something, because there is not many professional conference have that kind of understanding, Dato.
And I can I have just one more minute?
Sure.
Can you also expand your people who come to share this lived experience with other stakeholders? So it could be an employer who had a mental case treated. I mean, he did not stigmatize, or he gave opportunities. That employer can come and talk to other employers how important, and it's what's in it for me. And he said, I made better profits after I did not fire. So if there is something for them, so the other one is like the carer, the home carer. Like when I was working in Kuala Terengganu, there was two families, both one was a doctor, both were in the health service. One was a headmistress in a Chinese school. She was such a fantastic mother that mentally she will expose the son in all functions. She'll bring him to my house for birthday parties. The son, she'll take them out shopping. So I think she was, to me, a very good. The other one hid the son away at home, never let the son come out. So I saw the two extremes. And when my husband became the Rotary Club member there, he took my two children. I wanted to take you to this, not mental health, these are physically, some were mentally handicapped. handicapped. I want you to hug them. I want you to touch them. So my children were very unhappy with it. But we made sure that, so they learned that this is important. And my husband would take them shopping to the supermarket, this handicapped. My daughters would accompany them. So you bring in those other stakeholders who have nice stories to tell by their efforts in destigmatizing.
Yeah. This is also contact-based education, actually.
Just want to add to that. Instead of like we blaming stigma as the reason for them don't want to access to the services. Sometimes we didn't realize we do not understand them enough.
Betul.
Especially in terms of like men's and mental health. Men's, they don't want to come in the first place because they think that how are they going to share something that they don't have the enough vocabulary to talk about it, because they thought mental health services is only counseling.
But that's
only
also cultural, kan?
Yeah, so the whole idea, we need to figure out how are we going to go to them rather than just simply say that they don't want to come.
Right.
So again, the shift is not blaming, the shift is more understanding, to shift the perception of that.
Very good. Thank you. Thank you very much, Dr. Hazli and Dr. Narimah. I think we've come to the last segment of this podcast. Now, maybe Dr. Narimah, to you, and then Dr. Hazli, is what is maybe one advice you can give Dr. Narimah to the people out there? How can we all start shifting this perception? What can we do in our own capacities, mungkin Dr. Narimah, to be able to be more inclusive, to be able to have these discussions, to normalize these discussions on a daily basis? What would you say?
You mean to say
on mental health? Yeah.
Everyone in the community.
Everyone in the community.
Again, it's awareness. I mean, it's really awareness and telling them.
But what if they think, oh, well, it can never be me, it's not me, I don't know anyone who has the condition. How can we encourage people who have this mindset, though, Dato' Narimah? Because this is always the challenge, kan? Because even with MIASA, what we find is who consumes this information is people that are affected only, right? Tapi takkan kita nak tunggu until we are affected, then we do something. We want to do prevention, kan? So how do we encourage this, maybe?
To me, the two strongest messages I would give to them is when you stigmatize, when a mentally ill patient needs treatment, and because of stigma he or she doesn't go for treatment, you're only making the situation worse.
Betul.
And there'll be a lot of people who are treatable and not being treated.
Yes.
That means your family rugi, the whole nation rugi.
Betul.
That's number one. Number two, go back to human rights. This is basic human rights. You must respect people's basic human rights. And again, back to religion. It is what it is what all religions will preach, that you should not stigmatize, you should not discriminate.
Yes.
It's a very wrong thing to do.
Right.
So I think these are the biggest messages for people to change the perception.
Betul. Thank you.
That if you do not stop stigmatizing, the situation gets worse.
Betul. Right. Mental health is a human right at the end of the day.
And it is, number second, it is a human right.
Yes. Thank you. Thank you very much, Dr. Narimah. Same question to you, Dr. Hazli. Tapi maybe specifically to the young psychiatrist.
Oh. Okay. We need to have this kind of conversation.
Yes.
Real and honest conversation.
Betul.
And then, instead of just provide the service, just want to make diagnosis and then come up with a treatment plan.
Right.
No, we need to understand the person who come to see us, validate what they are concerned, understand their meaning, what they come, not just about what medication they need to take, what therapy that they need to go through.
Betul.
So, for the people out there, Anita, Dato, we need to continue the conversation about mental health.
Yes.
We are talking about action also. But first thing, we need to have a honest and really true conversation about mental health with the people who live experience, that also the professionals. So that's the reason nak promote a little bit, because I'm come up with a podcast, the Two Mankind. It's about two men talking about men's issue. Hopefully to talk about mental health, health of what men. And then another project that I'm going to do is about men, once they have the ability to share, and then they actually able to talk, and then they can be a good advocate because of the concept of brotherhood.
Yes.
So once they are being they recovered, they want to help other men. So there is going to have a support group for men only to talk about men's issue. They call it men luah.
Men luah.
But men luah. So this is talking about, for example, midlife crisis, what actually so the whole idea, we provide the platform, but what one skill that everyone should have, and then is possible to enhance that, is the ability to listen.
Mashallah.
And then which lead to empathy. So
it will be interesting, Dr. Hazli, to see how that works, because it's very difficult for men to open up. What more sitting in a support group kind of session. That would
so
be
I will
interesting.
I'll let you know.
Yeah, can I come as an observer?
No, you know why? Why? When there is a woman there, the dynamic is changed. But men cannot live without women.
Yeah. Okay.
So the whole idea, Dato, Narimah, Anita, the reason why we do that is not to, the alpha male or things like that. No, because we want to be a better man, because women deserve better.
Okay. All right. Okay. Thank you so much, Dr. Hazli, Zakaria. Thank you very much, Dr. Narimah, for sharing your time, knowledge, and thank you so much, and experiences with us today. And to our listeners, we hope you enjoyed the conversation and you are inspired in ways to where you can contribute to probably unpack stigma, shift perceptions. But ultimately, what we aspire to do is, of course, translate that into a change of behavior, guys. So thank you so much, everyone, for tuning in. Please catch us on Spotify under Real Conversations with Anita, and also MIASA Malaysia's YouTube channel every Wednesday at 6 o'clock. So please take care, everyone, and please take care of one another. Assalamualaikum.
Join us for Real Conversations with Anita, where mental health matters, brought to you by MIASA Malaysia.